Alright, so today we're going to talk about atherosclerosis. Um, I have to go a bit faster this time. Alright, so atherosclerosis is the formation of plaques in your blood vessels, and it's different from arteriosclerosis because arteriosclerosis happens in the arteries only, whereas atherosclerosis affects all vessels of your body. Atherosclerosis occurs in the tunica intima, which is the innermost layer of your blood vessel, and the plaque itself is formed by the outer fibrotic plaque, which covers an inner sort of mushy compartment made up of lipids and cells, which also compose macrophages. Now, with the plaque formation, there is the outcomes, which are the restriction of the blood vessel lumen, which causes reduced blood flow through the blood vessel, and therefore you have a reduced perfusion pressure. Now we know that there's a formula for resistance in blood vessels, and it is inversely proportional to the fourth power of the radius. Therefore, a small reduction in the diameter or radius of the blood vessel can cause huge amounts of resistance in the blood vessel, which is concurrent with how atherosclerosis happens. Therefore, you have a reduction in the blood flow. The body has to compensate by increasing blood pressure. You have a higher blood pressure, which can cause weakening of the vessel walls. Okay, so the process of atherosclerosis is you have risk factors which cause an imbalance in the lipid metabolism in the body. Now, the formation of the atherosclerotic plaque begins when lipid accumulate in the blood vessels, more specifically the tunica intima. When lipids accumulate there, macrophages are called to remove the excess lipids from the blood vessels, and these macrophages release chemical mediators, which the smooth muscle cells from the tunica media are called on by the chemical mediators, and they migrate to the tunica intima. The fibrofatty plaque is formed by collagen, which are released by the smooth muscle cells, the vascular smooth muscle cells, and the formation of this fibrofatty plaque is what transitions the atherosclerosis from a reversible mechanism to an irreversible mechanism. With the formation of the fibrofatty plaque, there is inflammation in the body, which calls on macrophages, Th1, Th2, and Treg. The lumen is protruded, and therefore you have turbulent flow. The downstream effects of atherosclerosis is you can have complete occlusion of the vessel as the plaque grows. You can have rupture of the plaque. With the rupture of the plaque, you can have thrombosis, which can travel to smaller blood vessels and completely occlude them. Or you can have aneurysms. Aneurysms are formed when the blood vessel is weakened by the turbulent flow, as blood damages the interior wall of the vessel. The macrophages that uptake the lipids form foam cells or lipid-laden macrophages, which is characteristic of its histological appearance, which is that you have large lipid vacuoles or lipid content. Now, when you have complete occlusion, it can lead to ischemic damage because blood flow is completely blocked, so cells can die, and this is tied to how angina pectoris is, because angina pectoris is when you have partial reduction of the blood vessel, and therefore when you exercise, your body needs more oxygen, but it's unable to get the oxygen that it needs because the blood vessel is partially occluded, and therefore you feel pain. Does the atherosclerosis affect aortas? And the answer is it partially affects it. by the formation of the plaque. However, the blood pressure in the aorta is too high. It's about 100 millimeters mercury in the aorta, and therefore the formation, the plaques are not able to form completely. Occur if they do form, they are broken. The plaques are broken, and they occlude terminal arteries instead of the aorta. Now, you also have turbulent flow in the aorta, which can lead to aneurysms, which we discussed. Now we're going to talk about atherosclerosis in the vessels of the organs. The first is the heart, and it's simple. It can affect the coronary arteries, and you can have occlusion of the coronary arteries, which can lead to a heart attack. There are no anastomoses, unlike the brain, where you have the circle of Willis. If it affects the circle of Willis, it can be compensated because there are anastomoses of the vessels. There is a phenomenon called watershed ischemia, which affects regions of the brain which already have a low perfusion, and therefore when there is atherosclerosis, it can affect these areas because the anastomoses do not provide enough pressure, which would normally be provided when unblocked. However, if it affects the extracranial arteries, it can lead to it has more implications, unlike the intracranial arteries. You can also have atherosclerosis in the intestines. Similar to the circle of Willis, you have anastomosis. However, the intestinal vascular system is very complex, and you have multiple anastomoses. Therefore, the occlusion of a vessel is not enough to cause immediate damage. However, if it affects more than one vessels, then there is higher risk of ischemic damage. In the kidneys, you can have renal failure because the kidneys are hyperperfused, and therefore you have the activation of the ROS system, which we will talk about in another video. When it affects the ROS, you have an increase in the blood pressure, which can cause hypertension.